And the key realization for me was that rumination, or this experience we have of what people historically have referred to as intrusive thoughts, is largely analytical thinking, meaning it is somebody actively trying to figure something out, which
Mm-hmm.
means that it's actually controllable.
Do you ever find yourself thinking the same thing over and over and over again, replaying a conversation, a memory, a what if, and no matter how hard you try, you just cannot turn it off? Do you ever feel like your brain has a tab open that you can't close? Have you ever wondered if what you're doing is healing or if you're just stuck in your own head? If any of this sounds familiar, this episode is for you. Hello, trauma brains. For those that are new, I'm Raisa, a trauma survivor who lives with complex PTSD. And I created this podcast because I know how confusing and isolating healing can be. Welcome to Hello, Trauma Brain. Here we talk about the ups and downs of healing complex trauma, boundaries, coming to terms with the fact that people I love were abusing me, and what it looks like to heal one slow and tiny step at a time. If you are living with C-PTSD or supporting someone who is, this podcast is for you. Welcome, new and returning trauma brains. I am so glad you are here. New episodes are released every other Thursdays or as my trauma brain allows. Before we get into the episode, a quick reminder, I am not a therapist or mental health professional. Everything shared here is based on my personal experience, and this podcast is not meant to replace therapy or medical support. If you think you may be living with C-PTSD or any other mental health condition mentioned here, please reach out to a licensed professional who can support you. Any people, services, or resources mentioned in this episode are not sponsors of Hello Trauma Brain, and the views shared by today's guest are their own. Also, this episode may mention trauma or topics that may feel activating. If at any point you need to pause, take a break, or skip the episode completely, please do what is best for you. All right, let's get into the show. So I have a few special announcements, and the first announcement is that I'm having OCD right now as I'm recording this. I tried so hard. Okay. Oh, okay. All right. So I have a few special announcements, and the first one is that Hello Trauma Brain has a website. I know, it's finally official. The website is hellotraumabrain.riverside.com, and I will be linking that to the show notes. So I want to real quick show you what the website looks like. Here it is. It's pretty simple. It has links to all the platforms that are streaming Hello Trauma Brain. You can also go through episodes. I still need to go back and change the thumbnail as I am updating things. You also get a choice about what mode do you want to see the website in. And by that, what I mean light mode or dark mode. And this is what it looks like. You can toggle this icon right here and switch back and forth. And you can also click this button right here to subscribe to the podcast. So yeah, very exciting news. And that being said, I also want to announce that now the podcast is available on iHeartRadio and Deezer, which is pretty exciting. After adding these two new platforms, I realized that Deezer is very common in France, and I have been seeing a lot of listeners from France tuning in. So to you, I want to say bonjour et bienvenue dans cette communauté. I took a minor in French in college, and sadly, I don't speak French very often, so a lot of it has kind of faded away, but I figured I would undust the little that I still know and remember for those of you that are tuning in from France. Okay, so May is Mental Health Awareness Month. And this episode, I want to focus on something that I live with every day besides my C-PTSD, which is OCD, which stands for Obsessive Compulsive Disorder. I haven't talked enough about OCD on this podcast, and quite frankly, it's something that I live with every day. I've had OCD since I was a child. I don't have many memories where I didn't have OCD in the picture. And like a lot of people with OCD, it took me a long time to realize that I even had it because I wasn't presenting with the stereotypical symptoms that we see portrayed in movies or shows, like somebody needing to put things in a certain order or washing their hands 50 times or turning around constantly to make sure that the stove is off or things like that. In fact, I recently heard Noah Kahan talking to Rolling Stones about how he just found out he has OCD. And I think he went for a long time without realizing that he had it for the same reasons that a lot of us do. He wasn't presenting with the stereotypical things. But yeah, OCD has a lot more than what we see on TV. I used to believe that if anyone found out about my OCD, I would be probably taken away to a facility and shunned, and nobody would talk to me, and they would think that something is wrong with me. And I spent a lot of years trying to hide it as best as I could, even though I would get caught here and there with my OCD spirals. I will say the bathroom was like the safe haven. Anyone with OCD, did you lock yourself in the bathroom and just ruminated and spiraled in there? I know I did. And if younger Raisa got to see me talking about OCD now on a public forum like this, she would probably fall out of her chair. But I've carried a lot of toxic shame about my OCD. And for the longest time, I felt like if I opened up about it, nobody would want to work with me or have me around them. And how am I going to make a living? And I thought that because of the OCD, I couldn't do things that I love, where I couldn't really take risks and be successful. And part of the reason I realized that I have OCD is because other people have been talking about it. And some of these people are making a very successful living for themselves, and they have OCD and they're still able to do what they love. So I have found that incredibly inspiring. And yeah, if I can return the favor by being that person for someone else, it's worth it. So here I am telling you all about it. I have OCD and I have had it for a long time. And yeah, it does disrupt my life, and it has disrupted my life, but it's also treatable. So I feel like admitting that I have it is the first step into doing something about it and getting the help that I need. A former therapist once told me that my OCD was likely a tentacle of the big octopus that is my CPTSD. And their hypothesis was, if we treat the CPTSD, my OCD, ADHD, and other symptoms that I have will also be addressed simultaneously. And she added that if the symptoms were not improving simultaneously, then we were probably dealing with separate disorders and conditions on top of the CPTSD. Spoiler alert, the OCD symptoms have not really changed much with the CPTSD treatment. So that's how I know that it's separate. Wow, I do think that having the trauma that I was experiencing did not help at all with the OCD. I've been seeing a different therapist for about a year plus now, and she brought to my attention that she's been learning more about OCD. And she's noticing that the treatment for OCD is actually very different from the treatment that is used for CPTSD. That opened up a whole can of worms. And part of it was that she introduced me to a newer way of treating OCD. I have tried the traditional methods in the past, or some version of them, and quite frankly, I wasn't really getting the results that I'm getting with this newer method. And in the process of learning about this new method is how I came across this episode's guest. My therapist recommended that I check out the work of Dr. Michael J. Greenberg on rumination-focused ERP. Before this, if you were to ask about my OCD, I would tell you that my type of OCD was the one that was linked to intrusive thoughts, because it was more inside my head, not physical stuff, even though I sometimes do have some of that. But I did not realize that this actually had a name, which is rumination OCD. Today, I am delighted to share my conversation with Dr. Michael J. Greenberg, a licensed clinical psychologist and the director of OCD Associates. His work focuses on compulsive rumination, something he sees as the cornerstone of all OCD and anxiety disorders. What pulled me to Michael's work is that he's not only just treating the symptoms on the surface, but he's integrating rumination-focused ERP with the deeper emotional and relational roots underneath, which felt really important as someone who has complex trauma history. For anyone who's new to OCD, during our conversation, we referenced one of OCD's treatment methods, ERP, which stands for Exposure and Response Prevention, and it's considered the gold standard therapy for OCD. So if you ask Michael, calling ERP the quote-unquote gold standard has done a disservice to the OCD community, as ERP does have limitations, which quite frankly, I ran into those, and it didn't quite give me the same relief that I have been getting with rumination-focused ERP. So in ERP, the exposure part means gently and intentionally facing the thoughts, feelings, and situations that trigger an obsession. The response prevention part means resisting the compulsion that OCD insists you have to do in order to feel safe again. Rumination-focused ERP, which is the method Michael developed, is different from regular ERP since it is designed specifically for mental compulsions, the loops of trying to figure out, analyze, and reassure yourself of a thought. That's the framework you'll hear us referencing throughout this conversation. I also want to throw a correction. During our conversation, I said that I had homophobia OCD, which is not the correct term. What I meant to say was homosexual OCD, sometimes now called sexual orientation OCD. In our conversation, we cover what rumination is and how it is different from intrusive thoughts, how rumination functions as a compulsion or mental ritual, why attachment and complex trauma history can intensify OCD loops, the 6 engagement patterns that keep rumination going, how to tell the difference between feeling your feelings and ruminating about your feelings, how OCD and C-PTSD can relate to each other, and core fear, what it is and why it matters. And now, without further delay, here's my conversation with Dr. Michael J. Greenberg. All right, Trauma Brains, I am so thrilled to finally introduce you to Dr. Michael Greenberg. Michael, thank you so much for joining me here at Hello Trauma Brain. How are you feeling today?
Me?
Yeah,
Oh, I'm good. Thanks for having me. As a
absolutely.
full disclaimer that it's a little bit early where I am, so I apologize for my morning voice.
Thank you. Thank you for letting us know, Trauma Brains. Michael made this happen very quickly. He's about to go on paternity leave. So I appreciate you taking your time as you're getting ready for your new baby and to wake up
Thank
as
you.
early as
Thank you so
you did to
much.
talk to me. Absolutely. I was hoping to start first with kind of the origins of your story. And I was wondering what drew you to study OCD in the first place? And was there something in your early career that kind of sparked and changed how you understood OCD?
Yeah. So my story is pretty straightforward in the sense that I'm probably in the world of OCD because I have OCD. It's not that direct, but that's the simplest version.
Hmm.
So basically, there's always been this like parallel journey of like what's working for me and what's working for my patients and what is not working for me and what's not working for my patients. So, for example, um, obviously, first, I don't. I mean, I guess this isn't an OCD podcast, so people might not know that the sort of mainstream first line of defense when somebody has OCD is called ERP, and it's a behavioral treatment, and it's like exposure therapy, meaning you just do the thing you're afraid to do.
Hmm.
That's It's not that simple, but it's almost that simple. And so the first thing that anybody with OCD is going to try is ERP. So I tried that, or I got trained in that. Like many people with OCD, I wanted to treat myself rather than ask for help. I tried to treat myself. There was some benefit from that, but very limited. Then I saw somebody who did ERP. It was very helpful, but I was hoping that it would be like a full solution, and it
Hmm.
wasn't. And then, so basically, I was doing ERP myself, treating my patients with ERP, confronting the limits of what that could do for me and for my patients. And then whatever next thing I was doing, I was always um, experiencing the benefit it had for me and the benefit it had for my patients, as well as the limitations, and seeing like what the next thing was that was going to help me.
That makes a lot of sense. And as someone with OCD, and I've tried the exposure thing, I I have both seen how it can help and also experienced the limitations with it.
Yeah.
And I feel like that's the thing that drew me a lot to your work, and the thing that sparked that, oh my gosh, I need to talk to this guy. Because my therapist basically recommended that I checked out your articles, and rumination OCD was like the thing that I had not heard. I feel like OCD for me, a lot of intrusive thoughts was like what I struggle with. And I am a survivor of narcissistic abuse. So, like, for
Mm.
me, so far before your work, what I knew about rumination was, oh, that's something that happens to survivors of narcissistic abuse. They're just going to ruminate. And I thought it was something that was just happening to me and I couldn't help it. It was just something I was going to have to live with the rest of my life. And then I heard about your work, and you have a new way of looking at rumination, which is something that you do, not something that happens to you. Can you explain what rumination is according to your framework and how you incorporate it into treating it with rumination-focused ARP?
Yeah, definitely. So if I were starting with a blank slate and talking about this, I probably wouldn't use the word rumination. meaning I use the word rumination all the time, I think because I'm in a field that has already used that term to describe a certain phenomenon. Um, but really, I would say it like this. I think the best way of conceptualizing any compulsive behavior is that it is something that you feel that you don't want to do, but you feel like you don't have a choice but to do. I think that's the
Okay.
best definition of a compulsion. It's not a perfect definition, but I think it's the most useful one. And so, from that perspective, rumination is just our word for compulsive thinking. So, what does that mean? It means that it's any thinking that you're doing that you feel like you don't have a choice but to do. I mean, you feel like
Okay.
you have to, but you don't really want to be doing. And the
Okay.
key, so that's, I think, that's what rumination is. Rumination is anytime somebody is sitting there thinking about something and thinking about something, and they would feel like they can't stop,
Okay.
but they don't want to be thinking about it. And the key realization for me was that rumination, or this experience we have of what people historically have referred to as intrusive thoughts, is largely analytical thinking, meaning it is somebody actively trying to figure something out, which
Mm-hmm.
means that it's actually controllable. In other words, if you just had a thought occurring to you over and over and over again, like I'll use a I'll use just a common example for people with OCD. Like one theme that people have sometimes is pedophilia OCD, that people are afraid that they're a pedophile. So and they're not. So let's say when people are ruminating about that, that does not look like you're a pedophile, you're a pedophile, you're a pedophile. That's not what it looks like. What it
Mm-hmm.
looks like is somebody actively sitting there actively trying to figure out if they're a pedophile, going over all of the experiences they've ever had and their feelings and their thoughts and looking things up online and trying to figure this out. In other words, it's a very active analytical thought process. So that's good because that's controllable. Analytical thinking is
Mm-hmm.
controllable. So
Mm-hmm.
you can't, that doesn't mean that you can make the question of, am I a pedophile, that haunts you, that you can make that question go away. But when somebody is spiraling, it's not just because that question exists for them, it's because they're sitting there very actively trying to answer it. And so realizing that rumination is really something that somebody's doing on purpose, and I'm using that term with all, obviously it's a little, what does it mean for it to be on purpose? There are unconscious
Mm.
factors
Yeah.
that are driving it, but it is subject to a person's control. The fact that it's subject to a person's control is huge, because it means that this isn't something you just have to live with. It's something that you have some control over. Um, and so my first sort of step out of traditional ERP was this realization, and I developed through working with myself and my patients this cognitive behavioral, I'll explain what that means in a second, approach to treating rumination, which focuses on, number one, helping people to realize it's analytical thinking and to realize that they can make a choice to stop figuring it out.
Mm-hmm.
And also some subtler points, like teaching people how to differentiate between awareness and attention, because that's a place where people get stuck. That's probably beyond the scope of today's podcast. So for
Mm-hmm.
the finer points, anybody can check out the articles that are available for free on the website. So that's available. But the bottom line is recognizing that rumination is analytical thinking. And this is true outside of OCD also. So for example, if somebody has PTSD and
Okay.
they're sitting there ruminating about what happened, true flashbacks are rare even in PTSD. Like what we imagine, sort of the stereotype of like a person flashes back to the battlefield in Vietnam, those are rare even in PTSD.
Okay.
And when people are thinking about things from the past, more often what's happening is somebody is sitting there, for example, trying to figure out what happened, or trying to figure out if it was their fault, or trying to figure out if there was something they could have done to correct it.
Mm-hmm.
And so that is also analytical thinking. And so
Okay.
recognizing that a person is doing that on purpose, and again, by on purpose, I just mean that it's subject to a person's control. I am psychoanalytic, which I'm sure we'll get to in a second. So I assume that there are very compelling unconscious emotional factors that are driving a person to do this. So I'm not
Mm-hmm.
saying that it's a person just wakes up and they're like, let's make myself miserable.
Right.
But it is subject to a person's control ultimately. Whether we're talking about OCD or rumination in any other context, the big realization for me that's been really helpful to my patients as well is that rumination is analytical thinking, and it is subject to a person's control. That's the bottom line. This also has implications for how you do exposure therapy, but that might again be beyond the scope of this podcast because it's not geared towards OCD.
I think that makes sense. And I want to pull a few things and highlight them. As a survivor of narcissistic abuse, like even hearing you talk about it now, I feel like a lot of coming to terms with what happened in my experiences, going back and like I've definitely ruminated about the things that happened. What did I say? Did I cause that? Was I to blame for this X, Y, and Z? In terms of the trying to figure something out, I feel like that's the part where I didn't realize that's what I was doing.
Mm-hmm.
I feel like it, like when I get my trigger and I start ruminating, I wasn't thinking, oh, I'm trying to figure this out. I'm just trying to figure it out. And I didn't realize that I could
Mm-hmm.
control
Yeah,
that. And
100%.
what I like about what you do is that you're putting the agency back on the survivors of the person that's having these symptoms. And like, it gives us something that we can actually do to help our case. Like, we don't have to just accept that this is going to be our curse for the rest of our lives. Like, there's things that we can do. And I will say, as someone who's trying it, it's not easy. It takes a lot of time. Well,
To learn how to stop
yeah.
or to
Well,
actually do it.
let me reframe that. So I feel like once I started to realize, okay, like this is rumination and these are the things that I can do to stop. And
Mm-hmm.
I have your article. I made a little Notion page for me that has like the 6 different things that I can do. And like it kind of like helps me figure things out. And that, like, I did feel a lot of relief fast from my typical rumination. But like this week, for example, like even getting ready for this conversation,
Mm-hmm.
I kept going on rumination cycles, and I'm like, okay, this is very appropriate. I'm ruminating about my conversation with an expert in rumination OCD. So I feel like the relief can be fast, but also like it's not like I don't want anyone to think like you just read the article once, you do it once, and then you're done. Like it's
Maybe I can. I mean,
practice.
I'll sort of give a
Yeah,
framework for thinking about that,
I would
which
love
is
that.
that the literal skill of how to stop ruminating, like if you're ruminating right now, how to in this moment stop, is
Hmm.
not complicated. Meaning, it's. I think you need to read the article. It's not something. It's not something a person with OCD just knows how to do. But
Hmm.
once you realize what you're doing and you sort of take apart a few of the places where people get stuck, you
Hmm.
can learn how to do that very quickly and you can totally turn it off.
Okay.
What's more complicated is making the decision. Well, I'm sort of stuck here. I'm conflicted here whether I want to talk on a cognitive level or a psychoanalytic level. I'll do both, but I'll stick to cognitive to begin with.
Sounds good.
So, from a cognitive behavioral perspective, having the foundational skill of knowing how to turn it off is simpler. That's pretty easy for most people, not for everybody. Sometimes people have trouble learning how, but ultimately everybody can learn how, and it's not a complicated skill.
Okay.
What's more complicated is making the decision to do that consistently. So, for example, going back to the example we used of the person who's afraid, what if I'm a pedophile? There's a reason that they feel like they need to figure that out.
Hmm.
So, teaching somebody how to stop ruminating takes rumination and it makes it the same as any other compulsion, like washing your hands. A person
Okay.
who's washing their hands compulsively also knows that technically they can stop, but the whole nature of the disorder is that they feel like it's really important.
Hmm.
And so, teaching somebody how to stop ruminating, to begin with, if you don't know how, then it's worse than washing your hands because you literally don't understand that you can stop.
Hmm.
When you teach somebody how to stop ruminating, you bring rumination down to just the level of any other physical compulsion,
Okay.
where a person recognizes that technically they can stop, but they feel very conflicted about it. Right? But so it's not, that was, I don't know, it began to be a little bit complicated, but do you understand what I'm saying? It doesn't make it go away, it just makes it as simple. It makes it the same as any other compulsive behavior, where a person, on the one hand, desperately wants to stop, but on the other hand, thinks that if they don't do this, they risk something really terrible happening. So
Exactly.
they're afraid, they know they can stop washing their hands, but what if they don't wash their hands and then they make somebody sick and then it's their fault and then etc.
Right. I'll mirror back and see like if I'm understanding correctly. So I feel like what I'm hearing and how I'm looking at it is So you got rumination OCD like over here, like it's just kind of, it's almost like the, like if I was to compare it to like a physical issue, is like, okay, I have a broken ankle and it's fractured and it needs like a surgery. So like ERP would have essentially been like, let's just do physical therapy and start putting weight on your ankle and like just wait for it to feel better and just get used to the pain. Like your approach would be, no, we need to do like like an actual intervention to get the ankle to like to a
I'll tell
place
you
where we
the
can start treating it.
I'll tell you the metaphor that I usually use, which
Yeah.
is if let's say a person's eating something that makes their stomach really hurt.
Mm-hmm.
Traditional ERP is let's keep eating it so we can make your stomach hurt even more and habituate to the feeling of your stomach hurting.
Mm.
Because, yeah. And this approach is like, if doing that is what's making your stomach hurt, then you need to stop doing that.
Yeah.
The answer is not to eat more of the thing and make your stomach hurt more and get used to it. The answer is to stop doing that. But the reason traditional ERP doesn't realize that when somebody has an experience of anxiety, it's because they're ruminating.
Mm.
Once you realize that the experience of anxiety, and I'll footnote this in a second, once you realize that the experience of anxiety is the consequence of a behavior, then habituation, the idea of just feeling anxious on purpose in order to get used to it. Once you realize it's the consequence of a behavior, that doesn't make sense anymore.
Mm-hmm.
Once you realize it's the consequence of a behavior, meaning of analytical thinking, then it only makes sense to stop the behavior in order to make the feeling go away. Does that make
Yeah.
sense?
It does. Yeah. It's like you stop eating the thing that's making you sick. Like
Right.
then there's no
Right.
point in eating it
Exactly.
just to get used to it.
Exactly.
Yeah.
The footnote I'll put on that is that you can use the word anxiety in different ways.
Mm-hmm.
Like you could refer to an unconscious, you could, if somebody's, let's say, having a somatic symptom, it wouldn't be wrong to say, oh, you're experiencing anxiety. The way I'm using anxiety is this subjective feeling that people have of when we say I am anxious, when we are consciously anxious, usually what we're referring to, usually that I would say always, I don't want to be extreme, but I think when we know that we're anxious, when we describe feeling anxious, what's going on is we are having some sort of a thought process that's actually making us anxious. So for example, if you were anxious coming into this podcast, or if I was anxious coming into this podcast, that means that we were thinking about what am I going to say? What's going to happen? Is it too early in the morning for me to be able to think straight? Did I have enough coffee? Like, is my voice going to sound funny? Like, those are all things I'm trying to figure out. It's not just, there's a thought process that's driving the anxiety.
Mm-hmm.
And if I turn off that thought process, then I won't feel anxious anymore.
Mm. Okay.
Okay, this is all again on a cognitive behavioral level.
Yeah.
Again, maybe chapter 2 of this podcast, we'll talk about how on an emotional level, that's not that simple. But in
Yeah.
terms of conscious experience, it is that simple.
Yeah. I hear you and it totally makes sense. And like I can think of times like even trying your approach where like it was a lot easier to stop the rumination and be like, okay, I'm doing it. And I kind of have like an approach of, I feel like it's like removing layers of an onion. So like your 6 things that you could be doing, like I remove one and then I'm like, okay, I'm doing this one now. And I have to remove that one and keep going until I get to like, I feel like the sweet spot is when I feel like I usually start getting like a headache, like here, like my prefrontal cortex, like if you could see it, it would just be smoking out. And once like that feeling kind of goes away, I'm like, okay, I think I got it. But there are some other ones where like it's stickier and it keeps coming back over and over and over.
Yeah. So what could be going on there is a couple of things. The main thing is, I didn't call this before, but justification, which is the reasons a person thinks that it's important to figure this out. So the person who's trying to figure out if they're a pedophile, you might say, oh, make yourself feel better. Don't think about that. But that person thinks it's very important for me to figure that out because maybe I need to do something different. Maybe I need to quit my job as a teacher. Maybe I need to not have children. Maybe I need to not go visit the children in my family. Maybe I need to not go near a playground. Meaning they're trying to they think that maybe it's urgent that they figure that out because they need to do something differently or they need to know that about themselves or something bad is going to happen.
Yeah.
And so it's not that simple to say, oh, you can stop, because even though technically they can stop, they also assign a significant value to figuring that out, or they feel like it's very dangerous to not try to figure that out. And so they're conflicted about doing it and not doing it. So
Mm-hmm.
addressing that is a whole part of the treatment framework, RFERP. After you teach somebody technically how to stop, then you have to sort out their justifications for doing it and help them to make a clear decision to consistently stop. Because knowing how to do it is not enough. You have to actually do it. The good
Yeah.
news is that most of the time, if you really take a look, there's really nothing to be gained from the rumination, from the trying to figure it out. And if
Mm-hmm.
you can help a person to see that, it makes it easier to stop.
Mm-hmm.
At least once you can really, if you take a moment to think about it, if you're really stuck and you take a moment to think, okay, what am I really trying to accomplish with this, and is it really going to work? Then it
Mm-hmm.
can be easier to stop. But suffice to say that people are conflicted, and that's a
Yeah.
big part of the picture.
Yeah. It just like this, I feel like OCD is sticky with the things that matter to us. Like whatever is important to us, like it's just gonna latch on to that. And I feel like that's gonna fuel the fire. And something that I also like about your approach is how it goes to the root of the issue. Like it's not just stop ruminating, like you're good to go and you can go, but it is now we have to figure out what's underneath it, what's the primary, like almost like
Mm-hmm.
what's driving it. And
Mm-hmm.
does this get into what you are? 'Cause I've heard or I've seen your articles about core fear. Like, is that where
Okay,
this is going?
that's a great question.
Yeah.
So yes and no. So core
Okay.
fear is what this is all about if you're thinking from a cognitive behavioral perspective. So just to explain to people, so again, I'm sort of recalibrating myself. I'm used to being on OCD podcasts where everybody has
Okay.
OCD is listening and everybody knows about ERP and everybody's all bored and you could just go. So I know that the audience today is people who don't necessarily have OCD, so I need to do
Yeah.
a little bit more
Thank
um,
you.
legwork. So basically, people with OCD sometimes show up with a whole bunch of really random, ostensibly disconnected symptoms. They're afraid that they're gay, but they're also afraid that they hit somebody with their car, and they're also afraid that they are going to molest someone, and they're also afraid that they also are afraid of spreading germs and hurting their children, meaning all these things that like seem, and they also, knock on the door a certain number of times in certain conditions. So
Mm,
these things seem to be like super disconnected.
mm-hmm.
Um, and then the idea of a core fear is that if you take any individual symptom and you really boil it down to what the person is afraid will happen if they get that wrong, if you do that for every symptom in a certain case, then what you see is that all roads lead to Rome, and that there's one core fear underneath all of those random or seemingly random symptoms. So it helps to see the order in a case. It helps with a few things. First of all, it takes a really seemingly incoherent clinical picture and it organizes it. And you can see the coherency in the symptoms. Oh, this is not just random stuff that's happening. This is all connected to one core fear, which we could talk about in a second. And then I think it helps in another couple of ways too. I think it helps with towards restoring agency. I'm not saying it automatically restores agency, but I think it's
Mm-hmm.
a step towards restoring agency because it begins to help a person to see that the things that they're doing are on some level strategies that they're doing on purpose to protect themselves from something they're very afraid of. So I think that realizing that, oh, I'm doing this or not doing this thing compulsively because I'm afraid that otherwise this will happen and then this worst thing will happen. I think that that is a step towards restoring a person's agency, which I see as sort of the main goal of a cognitive behavioral treatment for OCD is helping a person realize that they actually do have control over these things.
Yeah.
So that's one thing. And then since as I said before, I'm psychoanalytic, so I really believe that the more important work is on addressing the unconscious emotional factors that are driving the symptoms. So a core fear is also a step towards thinking about symptoms in terms of feelings. So it's a step towards thinking about, oh, because a core fear is always emotional. It's always some form of emotional distress that a person is afraid of experiencing. And
Wow.
so realizing that all these behavioral symptoms are really a way of avoiding, or not avoiding in a bad way, a way of protecting a person from a really painful emotional state.
Mm-hmm.
is also a step towards realizing that there are deeper emotional dynamics at play. So I think it's important in both of those for all those reasons. But even though it's a useful organizing principle, it is really the conscious narrative of what's going on, or the almost conscious narrative of what's going on. If you ask people the right questions, that they can tell you, they can get to the core fear right away. So if you say, what are you afraid will happen if you don't do this? Then this will happen, then this will happen. How will you feel this? And then that's the core fear,
Mm-hmm.
but it's still conscious. So that's still within a person's conscious narrative of why they're doing what they're doing. So that's cognitive behavioral. If you're psychoanalytic, then the idea is that the reason a person is doing this is by definition unconscious. In other words, the person that, and for anybody who's listening who's freaking out, what does that mean? There's secrets. No, unconscious, we're talking about just normal, healthy feelings that for whatever reason, this person has trouble with. And basically, because of how they were raised, this person has trouble metabolizing certain feelings. Let's say a person is afraid. That I use this example in an article. So for anybody who's read it, I apologize for repeating myself. But let's say a person is afraid that they've left the stove on, and they're afraid that they're going to burn the house down and that they'll be all alone and it'll be their fault. And that's the core fear across all of their symptoms.
Mm-hmm.
That's their conscious narrative of what they're afraid of. The unconscious narrative might be what we might discover is really going on unconsciously is maybe this is a person who is really has trouble acknowledging when they're angry at someone they love, and they're afraid of the destructiveness of those feelings, and they're afraid that those feelings will lead to ruining their family and being all alone. And so they're not aware that that's what's going on. They're within the conscious symbolic symptoms that to them are very compelling. They think that is really what's going on. And by they, I mean we,
Mm-hmm.
but almost by definition, what a person is afraid of in OCD is symbolic of a deeper conflict. So let's say a person's narrative is that they're obsessed with whether their partner is uh, again, I'm thinking of like specific case examples that I can't use.
Mm-hmm.
So can you give me an example of why don't you give me an example of an OCD symptom that you're aware of or you've heard
Sure.
of,
Yeah.
and I could give you an example of what that might be underneath.
Yeah. Okay. Now I have to think.
Yeah,
See
it's
what.
hard because there are infinite examples.
Yeah.
That,
Yeah.
yeah,
Yeah. So which one do I pick? I have so many. Um,
it doesn't have to be yours. I just meant you. Yeah.
like in general. Okay. Um, I could give you one of mine. So like, here's an example of something that happens to me. Like I feel like I'm hyper vigilant about my behavior, and I'm constantly monitoring feelings, thoughts, what I do, everything. It shows up in different ways. I do get scared that I'm gonna I live in an apartment complex, so, like, I do go to bed and wonder, like, did I turn off the stove? And I worry about, if a fire goes off, I'm not only, like, dying, everybody in this building is gonna fucking die because of me. Like, that's one. And I feel like also, like, for the
I
longest time
think
I
like
had hope.
for example, not to I don't want to cut you
Yeah,
off,
go for
but
it.
to interject along the way, I
Yeah.
think for the what I would hear there
Yeah.
is consistent with what you're already making the connection that here is a person who really feels like they need to totally cleanse themselves of any unacceptable thoughts or feelings, right? It needs to be really perfect all the time, not allowed to
Yep.
have any fill in the blank feelings, maybe no angry feelings, maybe no proud feelings, maybe no competitive feelings, maybe no
Mhm.
sexual feelings. I don't know what this person is exactly struggling with, but there are certain feelings that are not acceptable, and they need to make sure to never have those feelings. And when you're falling asleep, which is also this more vulnerable place where you don't have as much control over your feelings, you become afraid that what if I, what if I left the stove on? It's a displacement. It's a symbolic. It's a
Mhm.
metaphor
Yeah.
for what if there's this feeling that's still active.
Mm.
What
Okay.
if I haven't totally cleansed myself of all of my unacceptable feelings?
Oh, that's interesting. That's yeah,
That,
that's fascinating. I'll share. So like for me, and this is one of those things where like discovering something about myself kind of screwed me over. I had homophobia OCD for the longest time, and then
what
I
did you?
realized
You
I'm
said
by
homo.
homophobia OCD. Like I
Okay.
ruminated about, am I gay? Am I gay? Am I gay?
Hmm.
And
Hmm.
then about 3 years ago, I finally accepted I'm bisexual. So like that went away and great.
Hmm.
But other things still come up. Like, am
Yeah.
I going to hurt
Yeah.
someone? Am I going to do
Yeah.
something bad?
And
And
that's a tricky one. Let me pause there for anybody who's listening
yeah.
to this who has OCD.
Mm-hmm.
This is really a tricky one because, first of all, let's be clear. You could have OCD about being gay or about any sexual, you can have OCD about whether you're gay or bi or whatever. And that could be true that you are, but it can also absolutely be not true. And so having OCD about being gay, for example, does not mean one way or the other that you're gay or not. And if somebody's listening to this and they're like, oh my God, I have OCD about being gay, does that mean I'm gay? Not necessarily. In fact, I would say it tells you absolutely nothing about yourself.
Mm.
Yeah. And I'll,
I'm
I'll
so
make it
glad you
even,
said that. Yes. That's,
yeah.
I,
And then for people with OCD who have come to the realization that that was true about them, you and me. Although again, I want to reiterate for anybody out there,
mhm.
does not mean anything about you. Okay, there are
Yeah.
plenty of people who have OCD about being gay, and it's not true.
Yeah.
Um, and then it makes it scarier because here was this experience of having this obsession that turned out to be true. And
Mm-hmm.
does that mean the rest of our obsessions are true?
Yep, that's
Yeah,
the bucket I'm sitting on right now. Like
yeah.
that's the daily struggle, and I
But
think,
so I want to tell you, it's really
please.
OCD is more symbolic than anything else. So when
Mm,
the things that a person is afraid of are majority of the time, vast majority of the time, not true.
mm-hmm,
They're symbolic of something else.
yeah,
We probably could even say that our obsessions about being gay or bi, in addition to being the thing themselves,
mm-hmm,
were probably also symbolic of other conflicts.
mm-hmm,
So, for example, like somebody who has sexual orientation OCD, um, sometimes, I'm not saying this is true for every case, it's just an example of what it can represent. Sometimes it can represent that a person grew up with an enmeshed relationship with one parent
mm,
and felt like if they had a relationship with the other parent, it would distance them from this parent. And so, for example, somebody who presents and they're, let's say it's a woman who's married to a man, and
mm-hmm,
she says, "I'm afraid that that I want to be with a woman, and that'll ruin my relationship with my husband."
mm, mm-hmm,
So that could, I'm not saying in every case, but it's possible that represents it's possible that this person, when she was growing up, felt like if she had a relationship with her mother, it distanced her from her father, or vice versa. That they didn't grow up in a healthy environment where you could be close to two people at the same time and you didn't have to choose.
mm,
And so even in a case where it is true, it can also represent something else. Does
yeah.
that make sense?
It does. It does, and it's fascinating for me. And I think, man, if anyone listening, if you're take a moment, this can feel pretty heavy. And I feel like that's that's the complicated part. Like this podcast is about people with complex PTSD. So like our trauma histories are long and complicated, and there's so many factors. And I keep going back to like what I like about your approach is that it it keeps peeling off the layers because at the end of the day, like there is that one core fear underneath it all, but it's really hard to get to it because for somebody like me, it presents in so many ways, Michael. It's not even funny.
Yeah.
Like,
Well, I would say the same thing as I said about how to stop ruminating, which is
okay.
finding your core fear actually is probably very easy. We could probably do it in about 5 minutes. It's not a big deal.
Mm-hmm.
But finding your core fear is not going to solve your case. It's almost like
Mm,
a core fear is very, very important when you're working on a cognitive behavioral level to organize like
okay.
what is this really about.
Yeah.
But I think again we haven't really gotten into it, but I think that a cognitive behavioral once you realize that OCD and other psychological symptoms
Mm-hmm.
come from unconscious emotional conflicts,
Mm-hmm.
then the idea of just treating it behaviorally and thinking it's going to go away becomes laughable. Like it might help, you
Mm.
know, But at the end of the day, it's not going to make it totally go away, because how could it? Because you're not addressing what's actually driving it. And so
Okay.
finding your core fear is it's important to doing the cognitive behavioral work, which can be helpful,
Okay.
but it doesn't solve the whole issue. So I
All
think
right.
when people are sort of like, I have to find my core fear, I think there's a concept in general, but also in OCD, of an omnipotency and an omnipotent fantasy, which is a fantasy that I can have more control over something than I really do.
Mm,
So thinking that sometimes underneath an anxiety is an omnipotent fantasy. So for example, the person who's really terrified that if they eat the wrong food, it'll be carcinogenic and they'll get cancer.
mm-hmm.
Underneath that is an unconscious fantasy that if I eat exactly the right foods, I can prevent cancer. It gives a person a sense of control over it.
Yeah, I see what you
Right.
mean.
In that moment where you're terrified of eating the right thing, you're also feeling like you can do something to prevent cancer. So, okay. So similarly, I think people who are afraid, I didn't find my exact core fear, I need to find my exact core fear.
Mm,
Underneath that is a fantasy that if I find my exact core fear, all of a sudden all of my symptoms will go away, which I'm sorry to
okay.
tell everyone is not going to happen. So I think it's useful to find the core fear. And
Yeah.
when I used to work cognitive behaviorally, and I was really pushing a more precise approach to ERP, a more precise approach to cognitive behavioral therapy for
Yeah.
OCD, I think identifying a core fear is hugely important in increasing the precision of how you do ERP. Because I think
Okay.
ERP historically has been really an approach that sounds simple in theory, but in practice is super messy, and everybody's doing it a different way and thinking differently about how you do exposure and what you do as exposure.
Mm-hmm.
And so what I
Mm-hmm.
tried to do is really streamline it. And I think the core fear is a big part of streamlining it, of like,
Okay.
what is this about? What are the symptoms? What are we targeting, etc. But it doesn't address anything unconscious. So
Okay.
it's not part of the analytic part of treatment. And the
Okay.
more analytic I've gotten, the less sort of interested I am in core fear, because it's just on a cognitive behavioral level.
Okay. This is
Yeah.
fascinating to hear. I'm glad you said that because I totally had magical thinking about like, oh, I know my core
Yeah.
fear. I am scared
Yeah.
that I am gonna be bad like them and we're good. So
Yeah,
there's
right, exactly. I also
yeah.
want to sort of flag here, the concept
Yeah.
of core fear does not belong to me. I got that idea from Elna Yadin. I sort of refined it a little bit, and my idea of it is a little different from hers, but it's not my idea. I just want to give
Yeah.
credit where credit is
No.
due.
Fair. And thank you for doing
Yeah.
that. And I'm glad you're still incorporating things from other frameworks like even ERP into your practice and everything that you're doing. And okay, so I wanted to ask about the attachment piece too, because I've heard
Hmm.
you talk about it in other podcasts. And I
Hmm.
feel like definitely for people like me who are listening to this, like there was an attachment issue like from the get-go. And I feel like when I've heard you talk about how, for example, like a narcissistic parent can cause some of this stuff, like I'll insert myself a little bit here. There was one example that I heard you talking about that resonated with me, which was I was definitely the kid who couldn't feel angry at these people and
Hmm.
saw what happened if you got angry at them, and it was
Hmm.
not something I could afford to do. So
Hmm.
I started getting anxiety and OCD, and it was
Hmm.
clear, like people were noticing it. And I
Hmm.
got shamed for the symptoms and I got shamed for like acting crazy and things like that. So like I was curious to hear how did you make the link with the attachment piece, because I feel like that's core for someone with CPTSD, and I
Hmm.
think in my case it also kind of fueled and made my OCD a lot worse.
Yeah. So if you're asking like what is the attachment piece, I could definitely answer that. But you're asking how did I arrive at the attachment piece? And
Yeah,
that
I
is a
did kind of
question
ask
I
both.
have not
Okay.
thought about. Okay, I have to really
Okay.
think, how did I arrive at the attachment piece?
We totally can skip that part if you
No, it's a
like.
great question. How did I even
Yeah. Okay.
get
Yeah.
there?
I'm curious to hear what comes up.
I think, I'm not sure about this, but I think that it was from doing core fear, like looking at core fears with people over and over and over again.
Yeah.
I think that I just over time started to notice that it was almost always some version of loss of attachment.
Mm.
I think that there
Wow.
was that. And then, I think also Malin. There's a David Malin wrote, he was one of the founders of short term dynamic therapy, which
Mm-hmm.
I notably don't practice, but he wrote a book that I found really useful as an entree into psychoanalytic therapy called Individual Psychotherapy and the Science of Psychodynamics, for anybody who wants to check that out. So I think that he talks about OCD in terms of a conflict between, I think maybe that's where it came from. I think it was some combination of reading Malin, who I think talks about um, OCD in terms of aggression, threatening attachment, I think, and then also seeing people's core fears in terms of loss of attachment, different
Okay.
versions of it. Although I'll note that that's not always the case. The core fear is not always a loss of attachment. Yeah.
Understood.
Um, yeah. And does that answer the question?
In terms of how you arrived to it, yes. Are
Yeah.
you still able to like talk about the like how the attachment piece links to it a little bit
Yeah.
more?
Yeah. So I think I want to sort of again give a little. I'm giving a lot of notes, but I'll give a little footnote here. Not I'm going to explain this in a way that I think is accessible and correct, but I do want to acknowledge that there are different schools of thought within psychoanalysis, and
Mm-hmm.
that some schools of thought in psychoanalysis would not endorse exactly this approach. Okay, I can probably beyond the scope to explain that, but I'll just give my version.
Sounds good.
So my version is like this, and it's in the article, so I apologize for repeating myself. How do we learn to process any of our feelings? How do we learn to manage any of our feelings? When we're an infant, we just have the direct experience of our feelings in our bodies. We
Mm-hmm.
don't know what we're feeling. We don't even know that we are a subject. We don't even think of ourselves as a person who's having a feeling. We're just
Mm-hmm.
literally in it. We're just having the direct experience of the feeling. So, for example, if a baby is hungry, or if an infant is hungry, they don't know that they're hungry. They don't even know that they're they. They're just
Mm-hmm.
having the direct experience of pain and distress. And then, if all goes well, you have a caregiver who comes along and says, "Oh, you're hungry," and feeds the baby.
Mm-hmm.
And what that does over time is two things. Number one is it helps the baby over time to develop an idea or a thought to go with this feeling. Oh, this is hunger. Like that's what I'm experiencing,
Mm-hmm.
which itself is very containing. Like when we're hungry, we know we're hungry, and we're like, oh, that's why my stomach hurts. That's why I'm shaking. That's why I'm pissed. Like,
Mm-hmm.
so we understand what's going on, and that helps us to manage what we're experiencing.
Yeah.
So that's number one, a thought to go with the feeling. And the other thing that that response does over time is it communicates to the baby that there's nothing wrong with feeling this. In other words, it doesn't alienate the other. So you're hungry is first of all a thought, like an understanding of what's going on, and it's also like, and that's okay, like that's fine.
Mm-hmm.
So when over time the baby is able to formulate an idea of hunger and integrate that into the self. This is one of the things that I experience. This is part of me. This is a state of mind, a feeling that's part of me.
Mm-hmm.
And the same process happens for all other feelings. If I feel, if I'm an infant and I'm feeling angry, or maybe as an infant we'd call it fussy,
Mm-hmm.
right? And a caregiver says, like, you're feeling fussy today, or you're in a bad mood, or whatever, then again, what that communicates is a thought, like, this is, oh, that's what this is. Again, not one time, but over a million times, a thought to go with the feeling. And also, like, and that's okay. Like, that's part of being a person, and then I can know about myself, like, oh, okay, sometimes I feel fussy. When there is this process can break down in either way. We can either have a caregiver who doesn't understand or misunderstands what we're feeling. Okay, let's say a caregiver who we're really feeling, I don't know, angry, and the caregiver like feeds us, right? I don't know, maybe a bad example, but we're feeling tired and a caregiver feeds us, or we're feeling whatever and a caregiver gives whatever misattuned response or just doesn't understand what it is that we're experiencing,
Oh, man. Yeah.
or has a bad reaction to something that we're feeling. Okay, so
Mm-hmm.
let's say if we're crying, I'm being an infant here. Let's say we're crying and the caregiver gets very anxious, right? Or let's say we're um, like asserting something that we need in an infant's way, and the caregiver has a bad reaction to that,
Mm-hmm.
right? that can communicate that this is really not an acceptable way to feel. It threatens your connection with other people. When you cry, mom falls apart, or when you cry, mom or dad gets angry, right, or tries to distract you, or whatever it is,
Yeah.
or whatever feeling, whatever reaction,
Mm-hmm.
communicates that this is a feeling that alienates other people. This is a feeling that threatens your connection with other people.
Mm-hmm.
And so what we do is we use defense mechanisms to try to get rid of the unacceptable feeling or the feeling that we don't understand. Yeah. So OCD is a defense mechanism. OCD is one way that we can get rid of a feeling that threatens our connection to other people.
Mm-hmm.
I can go into details about how it's a defense mechanism, but the bottom line is it's a defense mechanism.
Yeah, I wanna pull on that because I feel like that's really important. And hearing you talk, I can definitely feel like definitely the OCD is distracting me from an emotion. And in my work, like even before discovering your work, I kind of had heard from Dr. Michael, I'll say, about the connection with the emotions. So like I am aware that usually it's an emotion that I'm trying not to feel, and the OCD is trying to distract me from it. Now, just to kind of
While that's true, I just want to flag that that makes
yeah.
it sound a little more conscious than it is. It makes it
Okay.
sound like
Tell me
if
more.
only you would stop your OCD, then you would feel your feeling.
Okay.
Okay.
I see what you mean.
There are deeper, so this is the reason that I'm not into, for people who practice it, God bless, I'm sure you have a great way of practicing it. But this is what turned me off from um, intensive short-term dynamic therapy. In that kind of therapy, they're kind of like pushing you to feel the feeling that you're denying. But that
Okay.
assumes that a person knows what they're feeling. That assumes that that it's like right close to consciousness. And in fact, it might be something that's like deeply, deeply, deeply buried. So, eh, so even if it's not so simple to just stop it's not as simple as like stop the symptom and then boom, you have your feeling. And
Yeah.
it's also not so simple what the feeling is. And so a psychoanalytic approach is like very, very slow and very gradual and very like over a lot of time, layers sort of slowly soften and slowly peel off and slowly move. So,
Yeah.
so while it's true on the simplest level that an OCD symptom is in part, if you want to call it a distraction, I would call it a displacement, but it is also in a way a distraction,
Mhm.
a displacement of accent.
Yeah.
It's not as simple as like, okay, instead of looking at that, look at this, and then boom, you're
Yeah.
better. Yeah.
Okay, I do. So I will insert a note myself. I Dr. Alsay's work is not that you just feel the emotion and you're done. Just want to clarify that. But he does talk about the like how emotions can play a role, and that brings me to something I did want to ask you, which is about emotions per se. And I feel like you started to answer it a little bit more, but I want to ask you specifically because I know one of the things that you can do that can get in the way of stopping rumination is to then try to just like you said the emotion as like the
Hmm.
replacement. It's like somebody like me who's like, I'm trying to like, I'm okay with feeling the thing. Like
Hmm.
I'm finding a hard time drawing the line between what's letting an emotion be felt in a way that I can
Yeah.
reclaim it and what makes it become the fuel for more rumination.
Okay, so let me help you. Okay.
Yeah,
Here's
please.
the simplest way to help you. I have
Okay.
really bad news for you. You cannot treat yourself. It does not work. You cannot figure out your own unconscious feeling and then on your own make yourself feel it. It doesn't
Mm,
work. The quote that I put in both, I use this quote a lot. I love it. I think it really gets to the heart of the issue. Is Margaret Little said, trying to see your own unconscious is like trying to see the back of your own head. You can't. It doesn't work. People with OCD are, like we said, omnipotent or tend towards a desire for omnipotency. We need to believe that we have grown up feeling helpless about certain emotional experiences,
mhm.
unconsciously helpless. Like, I don't know, I don't have this problem, I don't even understand,
Yeah.
and I don't have anything to do about it. And so we need to believe that there's something we can do about it for ourselves.
Hmm.
We've also grown up without help that we needed with these issues. And so we needed to believe that we could do it ourselves because help is not available. And it's not possible. Bad news for everybody who wants to treat themselves, it is not possible. You can do the behavioral work, some of it you can do yourself. That's real. You can teach yourself how to stop ruminating. You can work on your justifications to some degree. You can even do exposures. These are things you can do by yourself. When it comes to addressing unconscious emotional conflicts, you cannot treat yourself. And this is sort of the it's not a contradiction, but the tension in holding both a behavioral and the psychoanalytic perspective with somebody with OCD.
Mm-hmm.
People with OCD, ironically, both have they feel like they have less control than they do when it comes
Mm,
to behavior. They feel like they don't have any control, but actually they have much more control than they realize. And that's, I think, the whole purpose of a behavioral treatment is to
yeah.
restore a sense of agency and control.
Mm-hmm.
But when it comes to our feelings, we feel like we have much more control than we actually do, and that we should be able to control our feelings and choose which ones we feel and
Okay.
whatever.
Mm-hmm.
And we don't have control over our feelings.
Mm-hmm.
Like how you feel is how you
Yeah.
feel. And
Yeah.
you also don't have control over your defense mechanisms. Like you can't just choose to make it go away.
Mm-hmm.
And so in that department, we actually we need help. You cannot do it for
Yeah.
yourself. And people with OCD do not like dependency,
Mm-hmm.
probably because we have a history of feeling like we couldn't depend on other people.
Yeah.
And so the behavioral part of this treatment emphasizes restoring agency. I would say the analytic side requires letting go of some omnipotency and opening up to the fact that you're up to dependency, that you're going to need help.
Mm-hmm.
And anybody listening with OCD just heard the word dependency and was like, isn't dependency bad? And the answer is no. People actually need help.
Yeah.
Everybody needs help.
Yeah.
Everybody needs other people for things. It doesn't mean you're globally dependent on someone else, but it means that, for example, for an analytic treatment, you can't do it on your own and you're going to have to find a talented analyst to help you.
Mm-hmm. Yeah. And to even, bring that point home, like that is how I got to your work. I didn't find it on my own. Let me tell you, I've been I've been out there looking for years. And when my therapist introduced me to your work, I was like, how did I not fucking know about this? Like it's yeah, I definitely need help. And I'm glad that I have the resources to have someone. And I feel like that's one of the things that's the most heartbreaking, that some people listening to this wouldn't mind getting the help, but it's hard for them to find it and to afford it. And, it almost feels like all the stars have to align sometimes to be able to find that help
100%.
you need.
I'll
Yeah.
just, for anybody who is interested in getting relatively, obviously they're relatively less expensive analytic treatment. The behavioral stuff, what I can offer is that you can do some of that. I don't know where to point people for really inexpensive behavioral treatment, but you can use the resources on the website to some extent. And then I guess even in that department, there are training centers, depending on where you live, where you might be able to see a student who's getting trained in it. On the
Mm-hmm.
analytic side, for anybody who's looking for less expensive psychodynamic work, one way to do that is to try to be a control case, which is to see somebody who's being trained in psychoanalysis. It's still going to be out of reach for some people, but it's significantly, significantly less expensive.
Wow.
So that's
I
one way
did
to do
not
that.
know that. Thank you for sharing that. I'm glad you mentioned that. I did want to ask you one more thing, and it might be like a hard
Yeah,
left
yeah.
turn. So if
No,
it's
go
something
for
you
it.
can answer, yeah, will you let me know? But so so the therapist that I'm working with right now, we do inner child work, and we do it through the RRP, so which is the relationship recovery process. And in a nutshell, some of the inner child work involves we identify the trigger, ask my inner child where did she go back to, where this was happening. We hold the people that did the abuse accountable, and then differentiate how the present is different from the past and kind of bring her back. So that has been helpful, but I feel like as someone with rumination, sometimes like I feel like it can be a slippery slope for somebody like me into going into ruminations. I was wondering if you had any modifications that you've seen that's done with inner child work, or how do you work with it if you've seen it in your practice?
Do you want to tell me how it leads to slipping into rumination?
Yes. So if I am doing it, so it's usually in writing. That's the way it's supposed to be done, because you want to stimulate both sides of the brain. So I'm writing with my dominant hand, and my inner child answers with her non-dominant hand. So that's how that works. And if I'm doing it in writing, I tend to be pretty good at it, but I feel like it can become, even like we're working on something and then I might start ruminating about something and then we're dialoguing about that. And then I'm next thing I know, I'm like, 6, 7 pages in and my hands are hurting. And I'm
Hmm.
like not, I feel like I can deviate from what we were supposed to be talking about to begin with. And then I do sometimes just talk to her out loud. And that's usually when the rumination can kind of kick in. And then next thing I know, I'm trying to figure something out.
Okay, I'll give I could answer, I think there are different pieces. I'm going to start with what I think is the main answer, which is what makes something a compulsion is that you don't want to be doing it. You could be doing the exact same behavior, and in one moment you want to be doing it, and in another moment you don't want to be doing it. So, for example, you could be dialoguing with that inner child and talking about other topics and going in other directions, and you're feeling like this is useful. I am happy to be doing this right now.
Mm,
And you could hit a point where you're like, I hate this. I can't stop, whatever. I could give I had a patient who a few years ago was knitting me a scarf.
okay.
And there was a point, not that my patients are always knitting me scarves, but this happened once. And she, up to a point, was so excited and enthusiastic about that she was learning how to knit and that she was knitting a scarf. And then she hit a point where she really didn't want to be doing it anymore, but she felt like she had to keep going because it wasn't
Mm-hmm.
like done. Um,
Mm-hmm.
and what I love about this example is that if you were watching this person in the room, they would be just doing the same thing the whole time.
Oh,
But
yeah, yeah.
internally, at first, this was something that they really wanted to be doing, and then this was something that they really didn't want to be doing. And so I
Okay.
think the same principle applies to rumination or to anything else. Or
Yeah.
like historically, I would compulsively think about OCD and how it works and writing and whatever. And there were times when I wanted to be doing that and it was constructive, but there were other times when I'd be doing that and when I really didn't want to, I wanted to be with other people or focusing on other things or whatever.
Mm-hmm.
So that's, I think, the most important answer to this question for you, which is if you
Yeah.
want to be doing this and you're, getting something out of it and you're happy to be doing it, keep going. And then
Mm-hmm.
if at some point you're like, this is not useful or I want to stop, stop.
Mm-hmm.
Now, of course, there's some concern or some omnipotency, depending on how you want to see it, about can maybe the anxiety would be, but what if I would have come up with something that was really important and would and whatever, and I won't do that, and then I'll be sick forever, or whatever your core fear is.
Mm-hmm.
Um,
Mm-hmm.
or on the omnipotent underbelly of that, maybe if I keep going, I'll come to some breakthrough and completely solve my problems. So you want
Yeah.
to sort of recognize those things and stop anyway.
Well, that's very, very helpful. And actually, it answered something that I didn't have on my questions, but that I'll point out just for anyone who's trying this and maybe you've had this experience. Like when I started your work, I very self-aware, too much awareness for my own good sometimes. And I was like, okay, I'm gonna stop ruminating now and I'm never gonna ruminate again. And I went at it. And I remember I got like a song idea while I was in the shower. And I was like, I'm ruminating. I'm supposed to be taking a shower. I was like, wait, I do want to write a song. Like that's good. That's a helpful thing.
Exactly. So
So,
the point is that you have a choice.
yeah,
The
yeah,
point is that
that's
you have
it.
a choice, that you know how to stop paying attention, you know how to stop analyzing, that you
Mm-hmm.
recognize that these things are controllable, and now you
Mm-hmm.
get to decide, do I want to be doing this or do I not want to?
Yeah.
And let's say you're not sure. It doesn't matter. Like, it doesn't matter because in traditional
Mm-hmm.
ERP, like traditional ERP, not my version,
Yeah.
there's a feeling that doing a compulsion somehow has bad consequences. Like it makes your OCD stronger. Like there's sort of, it's like whatever. In this model, there's no such thing. In this model, it's like the cost of doing a compulsion is that you're doing a compulsion.
Mm,
In other words, so if you do it, nothing bad happens. Other than that, you're doing something you don't want to be doing and it's distressing. And
right.
if you want to stop at any point, then you can stop. So you don't have to know. It's not important whether there's no right decision about to do it or not do it. The point is just you have a choice. You want to do it,
Mm,
do it. You're not sure, so do whatever and then see how you
yeah.
feel. And then if you want to, you can stop.
That's basically like the nutshell of this. And I know that we're getting closer to the time, so I want to be mindful. I have a few more questions for you.
Yeah.
For anyone who's new to this, I just want to ask you this because I feel like we've been referencing it, but without explaining it. I know there's 6 different types of things that people usually tend to be doing when they're trying to stop ruminating. Are you able to briefly just outline the 6 types for anyone who's new to this
Yeah,
concept?
I'll make it even simpler. So first of
Go
all,
for
for
it.
anybody, there's an article that they can visit,
Hmm.
they can read, and it outlines all of this in further detail.
Hmm.
I feel like talking about it as the 6 things sounds a little gimmicky. It's
Yeah.
really, at the end of the day, all of those 6 things are, or 5 of them at least, are about paying attention and analyzing. The first one is when somebody's ruminating. It's like this. When somebody's anxious, they're ruminating.
Hmm.
When somebody's ruminating, we said what that means is they're thinking about something that they don't want to be thinking about. But then when you ask them to stop, they like don't know how, or they're trying to stop, but they're stuck. And so the 6 things are like, what are the ways that a person gets stuck? What are the ways that a person tries to stop thinking about something, but then can't stop? And the answer is mostly they're either analyzing, meaning they're trying to figure something out, which they can stop doing,
Hmm.
or in some way they're paying attention, which is also subject to their control. They're either paying attention to their thought process, or they're paying attention to what thoughts are entering their mind, or they're paying attention to some feeling in their body, or they're trying to not pay attention to their thoughts, and therefore they're paying attention to something in the room. So in
Hmm.
some way they're trying to control their attention, or in some way they are controlling their attention.
Hmm.
And then number 6, which I'll just say, but it's not an important one, is self-talk. Sometimes a person is trying to disengage, but they're then coaching themselves. It's like, okay, we're not paying attention, we're not ruminating. Okay, here's what whatever. And self-talk is totally normal. It's not a
Mm.
bad or weird thing. We all self-talk, but
Mm.
in the context of trying to disengage mentally or cognitively, coaching yourself on how you're disengaging is engaging. And so it doesn't work. So in that context, self-talk can keep you stuck. So that's
Mhm.
all that the 6 things are. They're different. They're the ways that you might be, the reasons you might be having trouble letting go of something are maybe you're still trying to figure it out. Maybe you're paying attention in some way, or maybe you're coaching yourself.
Mhm.
But if you can just sort those things out, then you can let go of it. So what I like to emphasize is that in contrast to other approaches like mindfulness or whatever, where you would have to do something in order to not ruminate,
Mhm.
this approach sees rumination as something you're doing, and we're teaching you how to stop doing it. So if you're not ruminating, you are not doing something. It's like if we said that the goal was to not run on the treadmill, right? And you said, what do I have to do instead? The answer would be nothing. You can do whatever you want in order to not, you don't have to do anything else in order to not run on the treadmill. You just need
Mhm.
to stop.
Yeah.
You could do something else. You could sit next to it. You could do something else. You could leave the gym. You could do whatever. But not ruminating does not mean doing something. It means not doing something.
Mhm.
And so all of these attention and analysis things are helping a person to realize, oh, you're still doing something. You're still doing something. You're still doing something, and helping them to stop doing these things and to let go
Mhm.
and to feel not anxious because they're not ruminating. So that's why not ruminating, if you're doing it correctly, if you're really doing it, is not effortful. It doesn't feel like it's hard. It feels like, oh, it's easy. I'm not doing anything. I have let go of trying to figure that out.
Yeah.
That question might still exist, but I'm not
Mhm.
working on it right now. The metaphor I've been using, I used to talk about having a math problem that you're not trying to solve. The
Mhm.
metaphor I've been preferring recently is it's like if you had a file open on your computer
Mm.
and you decide, I'm not working on that right now. It doesn't
Okay.
go away. It's open right in front of you. But if you were to
Yeah.
if you wanted to work on a project on your computer, you would have to like engage cognitively and start working on it.
Yeah.
And you could also decide, I'm not working on that right now. It's there, I see it, but I'm not working on that right
Mhm.
now. That's what it means to not ruminate.
I like that metaphor a lot. I've heard the math one before. I feel like this lands pretty good for me, and I'll share that like that. That person. Like the last layer that I usually have to remove is coaching myself
Okay, there you
into
go.
it. So like
Yeah.
definitely, yeah. I still need to practice more with it, and I appreciate you explaining it that way, Michael.
Mhm.
I wanted to check in with you. Is there anything that I didn't ask that you wish I did?
I had a question leading into this that I thought might be relevant.
Go for
I
it.
was thinking about C-PTSD in
Mm-hmm.
its most official definition, and I guess I'll just spell it out. So I think of OCD as coming from basically complex trauma. Um, Maybe not for anybody listening, we're not necessarily talking about capital T trauma. In other words, not like a one. I mean, that's the whole nature of CPTSD, is that we're not necessarily talking about, sometimes you could be, but we're not talking about like a one-off terror attack or a one-off sexual assault.
Mm-hmm.
Um, we're talking about like chronic traumatic experiences. And in that sense, like that's basically where I think OCD comes from also. Even if it's minor, even if it's subtle, even if it's hard to see,
Mm-hmm.
there have been these kinds of experiences. Um, but in CPTSD, like in the most sort of official definition, there are like flashbacks to or re-experiencing symptoms of the original trauma. And the difference for in OCD is that in OCD, you basically the original trauma would be disguised. In other words, the person would not be thinking about the original stuff that happened. They would be thinking about their obsession, which actually is not the real problem.
Mm-hmm.
And what actually happened, the things that affected them, are unconscious.
Mm-hmm.
And so I was just thinking about that. Like the person with OCD might not remember, might not realize that they had, for example, a narcissistic parent who they couldn't feel angry at, who always made them feel like if they stuck a toe outside of the electric fence, they were going to be eviscerated.
Mm-hmm.
They might not know that at all.
Yeah.
And they're just obsessed with whether they are just have OCD symptoms related to trying to never feel angry or trying to never see anything critical about somebody else or trying to whatever, or they're unconsciously very competitive but can't acknowledge it because that wasn't okay at home. So
Right. Oh, that's
so
good.
so they wouldn't be aware of it. So I was just thinking about that. I'm curious to hear your thoughts about it. It's
Yeah.
almost like OCD would be CPTSD, but the metaphor, like
I
everything's metaphoric.
Yes, and I feel like the CPTSD also has that metaphorical thing built into it, like an emotional flashback. Like, so I have both PTSD, and I when I go into a PTSD flashback, I can tell you like I went
You had
exactly
like real
where.
flashbacks.
Yeah, but like with CPTSD, when I have an emotional flashback, I don't know where the fuck I went. Like,
Hmm.
because it happens so much. It could be anything. And sometimes like I'm getting better at like, okay, it could have been this thing here, but sometimes it's like subconscious. Like I know the feeling and the
Hmm.
flashback kicks in and I have all the sensations coming
Hmm.
back, but I couldn't tell you
Hmm.
where it came from,
Hmm.
what exactly did the thing. And
Hmm.
hearing you talk about OCD in that way, it's almost like OCD is like more of that realm of those like emotional flashbacks where you're upset, like you're having the symptom, but you
Hmm.
can't
You
trace
don't
it
know what
back.
this is. Yeah.
Yeah.
I'll add one more thing just on that note. So that makes sense. And I appreciate you explaining that.
Yeah.
Something that's interesting in how psychoanalysis has changed over the past, whatever, 150 years is
Mhm.
that these days there's a lot less emphasis on trying to figure out the origin of what happened.
Mm.
It's still there, but it's not as focal. So,
Interesting.
for example, when I'm working with the way that I work, I'm much more concerned about or much more focused on what a person is feeling that they're having trouble acknowledging than I am trying to figure out where that came from.
Mm.
Meaning, we do still think about where that came from, and that is in the background, and we do over
Mm.
time come to some understanding. But
Yeah.
I think, and I'm not an expert on the history of psychoanalysis, so if anybody's listening and they think I got this wrong, you might be right. Um, you can email me.
Fair enough.
But my understanding is that or earlier on in the history of psychoanalysis, there was much more of an emphasis on like um, remembering what happened
Mm.
and going back to the scene of a crime and being more like an archaeologist.
Yeah.
And nowadays, that is still part of the conceptualization, but it's less a focus of how people work. So, for example, if you were in a certain situation where you were having what you're describing as an emotional flashback, I personally would be less focused on what was the original thing that led to this
Mm-hmm.
and more focused on what is the feeling that is destabilizing you that you're not aware of. There's some feeling that's
Mm-hmm.
coming up for you in this situation that is making you feel very anxious. It's very conflicted, and trying to understand what that feeling is and maybe what that conflict is, why you're scared to feel it.
Mm-hmm.
But mostly what that feeling is, and helping, because I'm thinking in terms of like that baby needing the mentalization and the containment. Like,
Yeah.
for example, maybe a person is at a party and they get really, really anxious, and they don't, what's not conscious is that they got really anxious because they were feeling jealous. Like somebody else was talking to their friend and they felt left out. And
Mm-hmm.
maybe feeling jealous is a feeling that they feel that they have trouble understanding, that they feel is unacceptable, Or maybe I'm trying to think of a good example.
I did
I
think that was a
recently
good example for whatever it's worth,
Okay.
but
I was just thinking of an experience recently where something made me anxious,
yeah.
and afterwards, I was talking about it with my husband,
Mm-hmm.
and I was like, what the conclusion we came to was like, I was just envious, like that was basically what happened, but it
Mm-hmm.
was just hard for me to just say, oh, it's just envious, like that's the whole story,
Yeah.
um, and it's like once I was able to just see it for what it was, I was like, oh, okay, like I can handle that.
Mm-hmm. Mm-hmm.
It's just ended. That's all that was.
Right.
Um, versus like being destabilized. What am I experiencing? What am I feeling? Something is wrong. I need to do
Right.
something, etc.
Oh, I'm so glad you shared that because I feel like it's also a human moment to like see like you're an expert in this stuff, but you're also a human being who's still experiencing these things.
Well, I'm still
And
in psych. I mean, I'm still in psychoanalysis
mhm.
5 times a week.
Yeah.
with
Right.
lots more to go. And I would say
Yeah.
that that's been enormously helpful. And I think I'm a
Hmm.
far healthier person than I've ever been in my life. Like I'm so much more comfortable than I used to be, but
Yeah.
it is not like a black and white, like, ding, you're done.
Right.
Like I
Right.
still have a lot of,
Yeah.
a lot of work to do. Yeah.
Yeah. I can say the
It's not
same thing
black
for
and white.
myself. Yeah.
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 I am so glad we've been having this conversation. Michael, I did want to ask you a question that I asked for all the guests
Mm.
here at Hello Trauma
Please.
Brain, which is if you could go back in time and the time machine takes you to a difficult time, what would you tell younger Michael?
Oh gosh, I'm gonna cry.
So that's allowed. That's okay.
I think I would say it's not going to be okay,
Hmm.
but it's also going to be okay.
Hmm. You got me with that. Thank you so much, Michael. I want to, before taking a moment to acknowledge your work, for anyone who is listening, who's new to your work and want to get in touch with you, what is the best way to reach you?
Um, yeah, me too.
Yeah, I felt that
We're
deeply.
both crying. Yeah.
That's
Um,
allowed.
yeah, I think the simplest is info@ocdassociates.com, or they can go to the website if they want to read the articles, drmichaeljgreenberg.com, or the easier version of the website is ocdassociates.com, and then you can find your way from there. That's easier
Okay.
to remember.
Sounds great. Everyone, I will link everything to the show notes so you'll be able to find Michael and his work and support him. I want to take a moment, Michael, to recognize your work, not only the work that you're doing on yourself that is showing, but the work that you've put in into making this content available to so many of
Thank
us
you
that
so much.
really need to hear it.
Thank you.
Thank you. Absolutely. And thank you for joining me today. I congratulations on your upcoming new baby. I'm very
Thank
excited.
you. Thank
Is
you so
this your
much.
first baby?
This is our first baby. Please,
Okay.
God. Yeah. We are tired already. I'm kidding. We're
Oh,
very excited.
I'm excited and ready for you both. Thank you
Thank
so
you.
much again for joining me here at Hello Trauma Brain.
Thank you so much. Nice to meet you. Thank you for having me.
Absolutely. It's been a pleasure having you and your inner kiddo here today, Michael. Hello, Trauma Brains. How are you holding up? I know this stuff is so hard. Hope you enjoy my conversation with Dr. Michael Greenberg as much as I did. If this is all resonating and OCD has also been wrecking your life, leave a little brain emoji in the comments section. And also feel free to share anything that you have found helpful in your OCD healing journey. In this episode's healing invitation, I want to offer you a few things to reflect on. Notice if you have any patterns of ruminating. When it comes to C-PTSD, we tend to need the regular steps and then some. When I started working on stopping my rumination spirals, which I am still working on, I found it helpful to first start noticing when I was ruminating. Spoiler alert, I ruminate all the time. Like, I'm recording this and I'm ruminating. I have had to stop and like put to practice what I'm learning, and it's still a work in progress, definitely. I invite you to pay attention and see if you find yourself repeating certain thoughts in your head or exerting a lot of energy trying to figure something out. If you notice yourself doing any of the 6 engagement patterns Michael talked about, that's data, not a failure. No need to judge yourself. These patterns were created to keep you safe when you were experiencing abuse, and now they might be inadvertently hurting you. I invite you to show yourself a lot of self compassion. I know, easier said than done, but when healing complex trauma, it takes time to learn new ways of doing things. One thing I will say, as someone who is now trying rumination-focused ERP, it's heartbreaking to think about how much of my life I have spent it in my head trying to figure something out. I feel like I have not lived my life that much. I have been inside of my head the entire time. And there's a lot of grief that has come up with that. I'm glad that I have this new tool because I would love to just live my life, not be in here. I wanted to name that because if this is new for you and it resonates and you start using it and you start seeing some changes, that might come along with it, which is completely okay. This stuff is, whew. When it comes to healing complex trauma, I feel like grief is just like the underlining emotion that keeps popping up. If you find that rumination is something that's taking a lot of time away from your life, I invite you to check out Dr. Greenberg's free articles. They're a great starting point either way, and reach out to his practice if you're interested in working with him. Please let me know how this episode's healing invitation goes if you choose to accept it. Before we wrap up this episode, all music and production are courtesy of yours truly over here. And I would love to share a few ways you can support this podcast. You can subscribe and leave a 5-star review wherever you are listening or by visiting the new website, hellotraumabrain.riverside.com. Share this episode with anyone you think might find it helpful. Follow the podcast on social media at Hello Trauma Brain. Subscribe to the Hello Trauma Brain YouTube channel and hit the notification bell to be the first to know when new episodes go live. And if you like, you can also make a donation via PayPal. Thank you in advance for your support. Even a little goes a long way in helping this podcast reach more survivors who could benefit from this content. No worries, links to everything will be in the show notes. Thank you so much for joining me and Michael today and for trusting us with your time and attention. Conversations about OCD, especially the kind that lives quietly in your head as rumination, can be hard to find and even harder to sit with. There is a lot of content out there, and you choosing this podcast means the world to me. Thank you for being willing to sit with the hard things. Thank you for showing up for yourself by listening to this. I hope you found this episode helpful. If you are someone who doesn't have OCD or hasn't experienced abuse and you listened anyway, thank you. Because awareness is not just for the people living it. It's for all of us. The more we name what rumination actually is, the less alone the people doing it feel, and the sooner they can get the right kind of help. I don't know exactly who needed to hear this episode today, but I believe you found it for a reason. Whether you've known about your OCD for years or are starting to wonder if those loops in your head have a name, or if you love someone whose brain works this way, you are in the right place and you are not alone. Take care of yourself this week, drink some water, and if you catch yourself spiraling into a figure it out loop tonight, see if you can name it. Oh, that's rumination. And let that be enough for now. No need to fix it perfectly. Just noticing is part of the work. If you are watching on YouTube, there will be links on the screen coming shortly that you can click to subscribe and check out other episodes. I wish you a gentle rest of your day. Thank you for your presence, and I will see you next time.